Biology, Part 164. The surge in The surge in IH and FSH production occurs about the 13th day and this direct cause of the ovulation. For the enzyme responsible for splitting the ovary wall at ovulation appear to be stimulated by high concentration of IH. Luteal phase. Number 2, luteal phase. After ovulation, the follicular cells take a new role as the corpus luteum and begin to secrete the hormone progesterone in addition to estrogen. The presence of both estrogen and progesterone in the bloodstream has the opposite effect in the hypothalamus to that of the estrogen alone. The combination of estrogen and progesterone exerts negative feedback effect on the hypothalamus, inhibiting the further secretion of releasing factors by lowering IH and FSH level drastically. Lowering IH and FSH levels drastically. No further follicular development is possible whilst the corpus luteum continues to secrete progesterone. If the egg cell is not fertilized, the corpus luteum degenerates about the 10th day after the ovulation and the cycle may be repeated. In the event of fertilization, the activity of the corpus luteum is maintained throughout the pregnancy by a hormone called human chorionic gonadotropin HCG, which is secreted by the implanted embryo. The presence of HCG in the urine is a positive indication of pregnancy and provides a simple means of pregnancy testing. Events in the uterus. Number 1 is that of the follicular phase. During the follicular phase, the rising level of the estrogen stimulates the development of the layer of smooth muscles and the myometrium and promotes the growth of the glandular epithelial lining of the uterus and the endometrium in preparation to receive a developing embryo. Number 2, luteal phase. After ovulation, the progesterone causes the enlarged glandular epithelium to synthesize and store the food reserves of glycogen. In addition, there is a great proliferation of blood vessels, making the lining fully prepared to accept an implanting embryo. In normal circumstances where pregnancy does not occur, the rapidly falling levels of progesterone and estrogen cause the myometrium and endometrium to shrink during the last few days of the 28-day cycle. A woman loses up to 50 centimeter cubic of the blood in what is called menstrual flow. And as a result of this shrinkage, these changing levels of estrogen and progesterone influence the reproductive tract in one further way. Glandular cells in the epithelium of the cervix secrete mucus which lubricates the vagina. Estrogen stimulates the production of mucus by these cells, but progesterone causes the mucus to become viscous and coagulates. In some mammals like rodents, this has the effects of producing a mucus plug which prevents the entry of bacteria into the uterus after ovulation and thus protecting the developing embryo.